Hi, my name is Terry Duran, and I am a nurse practitioner. And today we're going to talk about Alzheimer's disease. So let's get started. The subject of Alzheimer's is very near to my heart because I have a personal experience with my grandmother. She lived with Alzheimer's from her late 80s until her death at 98. So I witnessed her progression through all of the stages until the day of her death. I have also cared for residents at the long term care facility I worked at and have cared for patients with the disease. So let's get started. Alzheimer's disease is named after a Dr. Alzheimer. In 1906, he noticed changes in the brain of a tissue of a woman who had died from an unusual mental illness. Her symptoms included memory loss, language problems, and unpredictable behavior. After she died, he examined her brain, and what he found were many abnormal clumps and tangled bundles of fibers, which are now called amyloid plaques and tau tangles. Now, these plaques and tangles in the brain are still considered some of the main features of the disease. Another feature is the loss of connection between nerve cells in the brain. Alzheimer's is an irreversible, progressive brain disorder that slowly destroys memory and thinking skills and eventually the ability to carry out the simplest tasks. In most people, symptoms appear in their mid 60s. However, experts suggest that more than 5.5 million Americans, and most of them 65 and older, may have dementia caused by Alzheimer's. It is currently ranked as the sixth leading cause of death in the United States. Now, Alzheimer's disease is the most common cause of dementia among older adults. It is important to define dementia because many people get confused about the terms. Dementia is a general term to describe a loss of cognitive functioning, thinking, remembering, and reasoning, and behavioral abilities to such an extent that it interferes with a person's daily life and activities. Alzheimer's is the most common cause of dementia, as mentioned earlier. Unfortunately, there is no current cure, but treatments for symptoms are available and the research continues. Again, it is important to understand that there is nothing that can currently stop the progression of Alzheimer's. Treatments cannot stop Alzheimer's from progressing, but they can slow the worsening of dementia symptoms and improve quality of life for those with Alzheimer's and their caregivers. I currently work mostly with the elderly, and sometimes I can't even tell that they have Alzheimer's when they are treated early and appropriately. On average, a person with Alzheimer's lives about 4 to 8 years after the diagnosis, but they can live as long as 20 years, and that depends on other factors. What causes Alzheimer's disease? Unfortunately, scientists don't yet fully understand what causes it in most people. Now, in people with early onset Alzheimer's, a genetic mutation may be the cause. But late onset Alzheimer's arises from what they think are a complex series of brain changes that occur over decades. The causes probably do include a combination of genetic, environmental, and lifestyle factors. The importance of any of these factors in increasing or decreasing the risk of developing Alzheimer's may differ from person to person. Again, it is important to understand that Alzheimer's is not a normal part of aging, but the greatest known risk factor is increasing age, and the majority of people with Alzheimer's are 65 and over. But it's not just a disease of old age. There's approximately about 200,000 Americans under the age of 65 that have younger onset Alzheimer's disease. And it's also known as early onset Alzheimer's. Now, early onset Alzheimer's tends to be more aggressive than late onset Alzheimer's. So how does Alzheimer's disease affect the brain? Well, changes in the brain may begin a decade or even more before any of the symptoms appear. And this is called the preclinical stage. Now, during this stage, people seem to be symptom free, but there are toxic changes that are taking place in the brain. The abnormal deposits of proteins that we talked about earlier, called amyloid plaques and tau tangles, are found throughout the brain. Those neurons that were once healthy stop functioning. They lose their connection with other nerve cells and they die. However, many other complex brain changes are thought to play a role in Alzheimer's too. Now, the damage initially appears to take place in the parts of the brain essential in forming memories. As more nerve cells die, additional parts of the brain are affected and begin to shrink. Now, by the final stage of Alzheimer's, the damage is widespread and the brain tissue has shrunk significantly. So let's take a look at this diagram. This is the difference between a healthy brain and a brain with somebody with severe Alzheimer's. How exactly is Alzheimer's diagnosed? Well, usually it's a family member or even the person themselves that notice these subtle changes in memory. It's important to ask the family member and the person questions about overall health, the use of prescription and over-the-counter medications, their diet, their past medical problems, their ability to carry out daily activities, and changes in behavior and personality. The main diagnostic tool that I have used is called the mini mental status examination. It's fairly easy. It only takes about 5 to 10 minutes. Now, as a primary care provider, if that was abnormal, I, of course, would suspect Alzheimer's, but I would send them to a neurologist where they would get more involved tests. One that takes about an hour is called the Alzheimer's Disease Assessment Scale, but there are several more. It also is important to carry out some standard medical tests, so blood and urine, just to look for other causes of the problem. Also, brain scans are mainly used to rule out other conditions. So this would be a CT, an MRI, or a PET scan. Now, they will be normal, especially in the early stages of the disease, but on an MRI, there will be certain brain abnormalities in the later stages of the disease. So mainly the MRI may be repeated because it gives doctors information about how the person's memory and other cognitive functions are changing over time. This is an older slide, but it just shows the natural history of Alzheimer's disease, the mini mental status examination score, and this is just how it can change over the period of time. So you can kind of see that about that 9-year span right there. So let's look at the different stages of Alzheimer's disease. So in the preclinical stage, the changes in the brain begin to appear about a decade or more before the other cognitive symptoms appear. And during this stage, as we talked about before, people tend to be symptom-free. However, toxic changes are taking place in the brain. So the most common early symptoms of Alzheimer's is difficulty remembering newly learned information. Because Alzheimer's changes typically begin in the part of the brain that affects learning. But sometimes there's also subtle personality, mood, and behavior changes. So, for example, if somebody who is normally happy-go-lucky all of a sudden begins to have mood changes and they become moody and they might have some early memory problems, that might be important to get them in to get tested. So usually family or others close to the person notice the symptoms. The patient typically just has an idea that something is not right. Now, there's typically overlap between this preclinical stage and mild Alzheimer's disease. So let's take a look at this slide. There can be a lot of confusion with time and location, difficulty completing familiar tasks. Maybe somebody starts to misplace items, difficulties in problem solving, memory loss, unfounded emotions, and all of a sudden somebody starts to have difficulty with words. There can be poor judgment, withdrawal from social activities, or trouble with images and spaces. So the first stage in Alzheimer's is mild disease, and we just went over a lot of the symptoms, but I'll just go over this again. Difficulty learning new material, decline in recent memory, difficulty performing tasks. The appearance can sometimes deteriorate. decreased concentration and judgment, time disorientation, and difficulty finding words or naming objects. In this stage, since the patient is usually aware of their forgetfulness, they may withdraw socially and feel feelings of shame, helplessness, and frustration. As Alzheimer's disease progresses, people experience greater memory loss and other cognitive difficulties. Problems can include wandering and getting lost, trouble handling money and paying bills, repeating questions, taking longer to complete normal daily tasks, and personality and behavior changes, as discussed earlier. This is the stage that people are often diagnosed. Moderate Alzheimer's disease, in this stage, damage occurs in areas of the brain that control language, reasoning, sensory processing, and conscious thought. Memory loss and confusion grow worse, and people begin to have problems recognizing family and friends. That's how you know it is progressing into moderate disease. Most of the time they can't learn new things anymore, and they can't carry out multi-step tasks such as getting dressed or coping with new situations. In addition, people at this stage may have hallucinations, delusions, and paranoia, and may behave impulsively. Luckily, my grandma was a very sweet Alzheimer's patient. She was funny and cute, but I have taken care of Alzheimer's patients that have a lot of belligerent behavior. And I remember one time a couple of family members, they came out to me as I was caring for their mother, and they said, "We just want you to know that this is not our mother. She never used to swear. She never used to become belligerent." And it filled me with such compassion, and I just thought it was so sad. So once we get into severe Alzheimer's disease, the plaques and the tangles, they start to spread throughout the whole brain, and the brain tissues shrink significantly. The last stage is almost complete deterioration of bodily function, personalities, and behaviors. People cannot communicate and are completely dependent on others for their care. And near the end, the person may be in bed for most or all of the time as the body shuts down. So again, I just want to show you the difference between this healthy brain and the advanced Alzheimer's brain, just so we get an understanding of how much the brain actually physically shrinks towards the end of a Alzheimer's patient life. Now, the question is, how is Alzheimer's treated? Now, current approaches focus on helping people maintain mental function, manage behavioral symptoms, and slow down certain problems such as memory loss. But remember, these do not slow down the progression of the disease. There are many medications approved by the FDA for the treatment of Alzheimer's. You can take a look at them on the slide. These drugs work by regulating the neurotransmitters in the brain. And those are the chemicals that transmit messages between neurons. Again, they help reduce symptoms and help with certain behavioral problems, but don't change the underlying disease process. Now, they're effective for some, but not all people, and a lot of times they only help for a limited time. However, I have talked with Alzheimer's disease patients recently, and sometimes I can't even tell that they have Alzheimer's. They've even passed their memory test and just showing mild cognitive impairment. So there's basic principles of care for people with Alzheimer's, and it's important to remember that Alzheimer's patients will have good and they'll have bad days. So my grandma, some days I would go to the nursing home with my small son, who was always a delight to her, and we could not wake her up at all. We would talk to the workers. They would say, we tried to get her up for lunch, but we just couldn't budge her. And then other times, my son would sit on the seat in her walker, and I remember one time she basically ran down the hall with him. So everybody has good and bad days. Now, the difficult reality is that often, and most of the time, the disease becomes unmanageable, and most people will eventually need specialized care. Because the cognitive impairment leads to difficulty with basic activities like going to the bathroom or washing. Something as simple as getting dressed can become an ordeal. And even a person with Alzheimer's or another type of dementia might not even be safe at home. There can be wandering outside. There can be worsening behavioral problems. Caring for the resident gets very difficult. I would go to my grandparents' house and find my grandma sometimes just sprawled on the sofa in her pajamas, and she would smell like urine because my grandpa couldn't wake her up and couldn't wake her up to get her to the bathroom and to care for her because he had his own health issues also. So I would get her up, I would change her clothes, and I would clean her up. And she did not go into long-term care until my grandpa died. The goal of management in all stages of the disease is to produce an environment in which the patient can function with minimal failure and retain maximum ability. So we want the patient to maintain their independence in as many ways as possible for as long as possible. Regardless of the degree of the progression of their disease, the goal should always be to preserve available function and maintain current abilities. Now, there is a concept of function-oriented care and custodial care. So let's define that. Functional care is the goal of our care. Excess disabilities occur when we do more for the patient than what they need. Custodial care can take away the opportunities to preserve the abilities. So let's look at some examples of function-oriented care and custodial care. Function-oriented care would be walking with assistance to meals. Custodial care would be wheeling patients to meals. Function-oriented care is one-on-one and group activities. Custodial care would be lining up residents in just front of nursing stations so they just kind of sit there. Function-oriented care would be only assisting as needed. So you would want the patient to do as much as they can for themselves. Custodial care would be basically providing all their care for them, dressing them, and all the other essential functions of the day. Function-oriented care would be helping them ambulate or walk with assistance. Custodial care would be keeping patients in the chair all day. And because in long-term care facilities, we all know the reality of how busy we are. There's a lot of times that people are short-staffed. So this is really where the family members can come in. A patient who is, for example, taken to meals in a wheelchair for the convenience of the caregiver may in fact become non-ambulatory in a very short period of time. Thus, the system, rather than a disability, would constitute the cause. In these instances, developing a philosophy of care may pave the way for providing the most appropriate interventions because we want to preserve function. Other things would be to look for identifiable triggers. So maybe there is some behavioral issues, but the resident cannot communicate that they're hungry, that they're thirsty, that they're in pain, that they need to go to the bathroom. It's important to also use short questions to seek information. What's wrong? When a patient appears frustrated and combative, use a soft tone and with a gentle touch and try to redirect attention in conversation. It's always important for the caregiver to stay calm and try to separate themselves from the situation. And also learn the patient's pattern of behavior. A very common phenomenon in Alzheimer's is sundowning, where the patient is up all night, wandering around, walking around. I don't know if any of you have experienced that, but that would be a great time to bathe them, to do their essential care, whether, at nighttime. So the caregiver may also need to explain directions several times, and it needs to be done as slowly and simple as possible. It is also important to support the patient and help them maintain their self-esteem. Helping the patient to reminisce about happy times in their life, their memories, is one way to do this. Also, accepting the patient without being judgmental or critical, of course, is important because they have a disease. Never argue with the patient. Instead, try distraction or using the realities around the patient, such as a photograph in the room. So it might be a way, if a patient is becoming belligerent, to bring them back to happy times, to say, hey, is this your wife? Or you can simply play along. So I can remember towards the end of my grandma's life, she would get very worried about the fact that she wasn't feeding the horses. So instead of telling her, Grandma, there's no horses, or trying to reorient her to reality, I would simply say to her, Grandma, I just want you to know that we've gone out and we've fed the horses and everything is taken care of. And then she would calm down because she had grown up on a farm. Another thing I used to do as a nursing assistant is I would sing songs with people. So there was one particular patient with moderate to severe Alzheimer's, but she always knew the old songs. So we would sing old hymns, or we would sing, I've been working on the railroad. So that's also an option for patients. It's also important to monitor the patient's eating habits. And this is where the family can be of help. They can offer suggestions. And again, it can be another key area in which they can still provide care, because we all know how busy lunchtime is and dinner time and meal times. And any changes in the patient's behavior needs to be reported. Includes bathing, eating habits, grooming, activity, behavior, dressing, or thought processes. Anything out of the ordinary needs to be reported. So sweating, diarrhea, excessive drowsiness, falls, bruises, vomiting, muscle spasms, confusion, trouble breathing, constipation, because they're almost like at the end of their life, they're almost like they were at the beginning of their life, where they can't express their needs. They can't communicate how they feel, just like a baby cannot do that. I do want to mention the economic impacts on families with Alzheimer's disease. So the costs associated with it rise with the severity of the disease, but even the mildest form of Alzheimer's produces a significant amount of excess costs. This is where it's very important to get treatment early, because the anti-dementia medications can reduce the annual cost of caring for patients. And a large cost savings may be associated with the preservation of their cognitive and functional capacity, especially even in patients with moderate to severe disease. Additionally, this improvement in cognition may well translate into better care of comorbidities and protection against some of the complications associated with the disease. So, where are we on research in progress? Well, Alzheimer's is being very intensely studied, and it's at the forefront of biomedical research. Researchers are working to uncover as many aspects of Alzheimer's as possible. Some of the most remarkable progress has shed light on how Alzheimer's affects the brain, and the hope is that better understanding will lead to new treatments. Many potential approaches are currently under investigation around the world. You know, the human and societal cost of Alzheimer's is staggering, but there is hope that earlier and better diagnosis, increased knowledge of its natural history with support of the patient and the family throughout the disease stages, effective symptomatic drugs, and potentially effective disease modification strategies will have a dramatic impact on the number of persons affected in the future and the quality of life of persons currently affected. The fast pace of research and development is unique in neurological history and should lead to better future for our aging populations. I'd like to end with my own personal experience about Alzheimer's. When my son was born and we moved back to Michigan, I would visit my grandmother with my son about every 1 to 2 weeks. We would make a day of it. My son would sit on her lap in the wheelchair. We would walk across to the park when the weather was nice, or we would sit next to the creek. We'd feed the ducks. He would eat her food, play with her jewelry, and they were basically on the same cognitive level. And honestly, we had a lot of fun. Now, she didn't remember my name. She didn't remember her children's names. She didn't remember her grandchildren's names. But she would always remember and ask about that little boy, even when others visited her. Now, as her Alzheimer's disease advanced, I would often think about just the sadness of the decline in her quality of life. Yet that time in her life significantly impacted the life of my son. he would insist on feeding her. And I remember one time he even made one of the nurses cry. I turned around and I saw her crying, and she said, "That is so sweet." And he wasn't even fazed by the different sights and the different smells of her unit. He enjoyed her company. 2 weeks before she died, when he was about 5 years old, I remember we were walking in the courtyard. She was in this chair that leaned her back. She couldn't talk. She basically couldn't do anything. And he insisted on holding her hand the whole time. On the day she died, we went to the home, and my mother gave him her jewelry box. He held onto that box for about the next week, and he would not let go of it. And I believe it was his way of processing her death. So my point in sharing the story is that even in the late stages of the disease, there was still a purpose for her life. And I just pray that we would all keep that in mind. And whether we are caring for patients with Alzheimer's or going through this with our family members, there is still a purpose in their lives. Thank you for spending some time with me and even learning about my grandma. Hopefully, you have learned a lot about Alzheimer's disease. And now it's time to take your quiz.